We're really honoured today to be joined by the New South Wales Minister for Health and Medical Research, the Honourable Jillian Skinner. As you saw from our highlights video that was playing as you arrived, we've been fortunate enough to host a number of events that the Minister and local members of Parliament have been able to attend. Our staff really enjoy showcasing their work and sharing their achievements with you, and I'd like to thank you for your ongoing support. I'd be grateful, Minister, if you perhaps say a few words to us. Thanks very much.
Thank you very much indeed. May I start by paying my respect to the traditional custodians of the land, pay my respect to elders past and present, and to thank you, Fran, for that very, very informative, warm welcome. I'd not heard it done that way before, and I thought it was beautiful. So thank you very much for that. Thank you indeed. I wish to acknowledge my parliamentary colleagues, Brian Doyle and Melanie Gibbons, the Director-General, Dr Mary Foley, you, Phil, for the wonderful work that you're doing, along with your board members who are here, Amanda Larkin and the executive team from the local health district, Lisa Rathbone and all of the staff here at the hospital, clinicians, executives, researchers, volunteers, auxiliary members, fundraisers, and consumers. And I was really thrilled to meet so many representatives of those different groups before we came in here today. I'm always very pleased to visit these facilities. I've been out to Campbelltown on a number of times past, and to Camden, Liverpool and other hospitals within the local health district. I think it's fantastic that we have this annual public meeting on the open day. I think it's a marvellous idea, and each local health district is doing things a little bit differently. This is unique. As you'd expect, Phil, southwestern Sydney does it differently, and I'm thrilled to be here. I think this district is proof of the benefits of locally managed health districts which aim to ensure genuine accountability and local decision making. And you all do it slightly differently, which is why coming out and seeing that wonderful exhibition of what's going on here was very enlightening. You know, I said this at one of these meetings I went to last night. Last year I went to one. I think the word got around, this is the fifth of these local health district meetings I've been to this year, and there are more to come. I'm very, very thrilled to be doing it, because I'm only too aware of the wonderful work that's been going on, but to actually see it showcased and share my thanks to all of you for the work that you're doing. Particularly here, of course, in southwestern Sydney Local Health District. As I said, it's been my very great pleasure to visit on a number of occasions, and whilst it would be impossible to list all of the achievements, I'd like to reflect on just a few that I've seen. The physiotherapy team at Liverpool Hospital's Brain Injury Rehabilitation Unit won an award in the Netherlands for their research paper investigating fitness training within a circuit class for people with a brain injury. How inspiring is that? Fantastic work, and to get an international commendation for that kind of work. It just shows we do the best work in the world, and the best work in the world can happen here out in southwestern Sydney. We had the first cohort of new graduates from the Macarthur Clinical School at Campbelltown. Campbelltown Hospital complete their final year in 2011. 86 homegrown doctors graduated, while up to 140 new students began the 5-year course, bringing the number of student doctors currently enrolled to more than 500. Another wonderful achievement for the district and for the region. Campbelltown Hospital won a prestigious New South Wales Ministry of Health Award for a project which addresses the pain management needs of children who visit the emergency department. A really important project, tapped a nerve with me. Those of you who don't know, pain management was one of my personal priorities. 2 state-of-the-art CT scanners were installed at Bankstown Hospital, resulting in enhanced medical services for patients. A new Office of Preventive Health based on Liverpool Hospital campus was officially opened, a very memorable day where we also had a gathering to talk about preventive health, and it's offering the statewide coordination of initiatives to reduce lifestyle-related risk factors which can lead to chronic disease and subsequent hospitalisation. It was no accident that we located that in Liverpool. It was in acknowledgement of the work that needs to be done across New South Wales, but particularly in areas such as this. I congratulate all of you who live around our hospitals and health centres, who play a vital role in ensuring our services remain patient-focused and continue to meet the needs of the expanding and ageing population. This is particularly relevant where here in Macarthur it's predicted that within the next 4 years there will be almost 1 million people living in this region. Prior to this meeting, I visited the stall about the $139 million Campbelltown Macarthur Hospital development, where I saw plans and I tried to manipulate my way through the building and the artist's impressions. If you haven't seen that, you really should. It's brilliant work. I congratulate all involved, particularly health infrastructure, for the work that's being done in this space. It's so exciting to be here, and I know people like Brian Doyle and the other Macarthur members of Parliament are forever asking me to raise these things. If I ever talk about infrastructure development in Parliament and I haven't mentioned Macarthur, they go, don't I? Won't you? Absolutely. I can never give it a miss, because it really is so important. This investment and the work that consisting of the construction of new multi-storey buildings with new inpatient wards, ambulatory care, outpatient, allied health services, pathology and other services. This will be followed with great interest, and I look forward to an opportunity to return and view progress. Thank you for inviting me to be with you here today, Phil. I love to hear about your triumphs and achievements, your new models of patient care, your passion for medical research, your community engagement and your fiscal responsibility. You tick all the boxes, I think Mary would say. Thank you to all of you, staff, volunteers, for striving every day to achieve the highest levels of care for patients in the South Western Sydney Local Health District. May you all have a wonderful Christmas and a very, very successful 2013. Thank you for being here.